You need me to hold just a moment?
Should be good now.
Okay. Good afternoon. My name is Gretchen Kanan, and I'm the Public Relations Specialist for the Topeka Police Department. I'm also part of the Topeka and Shawnee County COVID-19 Response Public Information Team. I want to start by thanking our viewers who are watching on Facebook. And with that, I will introduce today's speakers. Director Linda Oakes, Shawnee County Health Department. Mayor Michelle De La Isla. Director Dusty Nichols. Chief Craig Duke. Chief Doug Schmidt. Regional Director John Atram. Director Melanie Bergers. And at this time, I'll invite Director Oakes.
Thank you. Good afternoon. As of now, we still do not have a positive case in Shawnee County. We have 10 tests pending. We have 136 negatives, and 143 people are being monitored in Shawnee County. I do want to make a few comments about, we've gotten a lot of questions about beauty shops and barber shops, so I'm going to read a statement about those. The restrictive orders we've implemented in Shawnee County are meant to provide social distancing by avoiding the congregation of large numbers of people, currently set at 10 or more. The orders are not meant to avoid all close interactions among single individuals or small groups, fewer than 10 people. We've received inquiries regarding the facilities that provide cosmetology, barber and beauty services, tattoo studios, nail salons, massage and like services, as well as fitness centers and gyms. Many of these are small businesses that are individually owned and or run by individuals who are self-employed. The main concern for these businesses is the closeness between the service provider and client. Many of the services we are discussing have training, standards, requirements, and guidance provided in their training and certification. If those are followed, the risk of transmission of any infectious disease is greatly reduced. It is the position of the Shawnee County Health Officer that at this time, there is no compelling public health risk that would require mandating the closure of these businesses. One concern for the owners, operators, and customers in the current situation is the social distancing in waiting areas and workspaces. These should follow the guidelines of 10 persons or less and a distance of 6 feet for 10 minutes or more. In addition, no individual with cough and fever should be allowed onto the premises. Business owners, operators, and customers can decide individually whether the risk, which is currently considered low but not zero, to be in one of these businesses outweighs the benefits. The acceptable level of risk must be a part of personal risk assessment. Personal risk assessments should include the following: social distancing, space, concerns over finances, hygiene, limiting contact to the least amount of time possible, staying conscious of coughing, sneezing, and properly covering your mouth. After owners, operators, and clients consider these issues, they can properly assess the level of risk they are willing to accept. As usual, these decisions will be reassessed as new information becomes available. To gain the best knowledge regarding the COVID-19 virus, please go to the Shawnee County Health Department, Kansas Department of Health and Environment, and CDC web pages and social media sites. Also, I want to add that we're getting a lot of requests about homemade masks. At this time, we don't know if those would be able to be used or not. So right now, we don't know if we would be able to use homemade masks. We're assessing that. Thank you.
Good afternoon. I just want to touch on a few things. The first thing I want to talk about is yesterday I addressed a rumor. And so based on that, and they keep flying, to tell you the truth. So we are developing a Shawnee County Rumor Task Force. We're reaching out to specialists and those who professionally run social media sites and trying to get their assistance. I'm hoping to have that go live tomorrow. It'll be a Facebook site. People can go out and grab that, and then we'll develop it past there. Part of that is, that's the best place to release it, we know, because that's where we're going to reach the most amount of people, and that's where we're finding a lot of these rumors. I'll have some more guidance about that tomorrow and how we're going to work that product. I want to talk about a little bit about business continuity. Again, we understand this is putting a lot of restrictions, and we know you need to keep your business going. So again, please look at your employees and make sure that they can work from home, or whatever your situation is. Try to keep that business going. We understand it's tough, but creative thinking has prevailed in the past week. So I think we should keep that going. The other thing we're working on is critical infrastructure and IDing those businesses that are essential to the services of Shawnee County and Topeka. Those normally include water, power, those kinds of situations. So we want you, again, to look at your business continuity plans and those essential services. I haven't mentioned this yet. We have the critical infrastructure, and then the essential services are those services provided to that critical infrastructure. If you own or operate a critical infrastructure, please reach out to those other businesses that provide those essential services to you and make sure they're also doing the same thing you are, so we have some depth in these plans, these continuity of operation plans. The last thing I want to just mention, Commissioner Rippon asked me to mention that the Board of County Commissioners will be as scheduled tomorrow. We will reduce the number, and it will be mostly a call-in, just like last week. That will probably be the norm as we go forward. We're practicing what we preach. So, thank you.
Good afternoon, my name is Melanie Bergers. I'm the director of the 911 Center for Shawnee County. I'm joined with our partners for first responders, Chief Craig Duke with Topeka Fire, the representative for the rural fire agencies, Chief Doug Schmidt, and our AMR regional manager, John Antrim. We've been discussing continuity of operations for our 911 center. We have discontinued allowing any visitors in the communications center. That's one thing that we've taken in place to ensure the health and safety of our staff. Obviously, we want to ensure that 911 continues to be answered, so that's our primary focus. We've also been working with our leaders here at the fire department to discuss different responses for medical type calls. We have several different questionnaires in place. I think the biggest takeaway today for 911 is to ensure that to let the community know that 911 will continue to be answered. It's business as usual for us. We'll continue to take calls and send the appropriate responders. We do dispatch for all law enforcement agencies within Shawnee County as well. So we'll continue to work with those partners and discuss the limited responses or other ways that they can make reports, whether it be over the phone or online, and provide those options to the calls that we take. Are there any questions?
What sort of protection are EMS responders using when on your daily basis?
As the director indicated, as soon as the 911 call starts, they're going to start that screening for COVID-19. In the event that it does meet that criteria of a suspected case, then you could expect our responders to have masks, face shield, gowns, and gloves.
Happy Sunday, everybody. A few updates for you with regards to some of the meetings that we've been having. Today in the afternoon, Commissioner Rippon, Director Nichols, and I were able to talk to Dr. Harley, just making sure that we are all on the same page and ensuring that as Washburn is trying to get back into school with their own online programs, that if there's anything that they need from us, they know how to communicate with us. In addition to that, we also had a really good meeting today with Topeka Metro. Topeka Metro is considered one of our critical infrastructure partners, and we wanted to ensure that we were able to have a conversation with regards to keeping the buses going, listening to how the ridership is operating right now, and what are future needs that we could make sure that we help them as they are transporting the most vulnerable population to their jobs or to get some groceries now and in the future. So those are two quick updates. Then I will start flipping into Spanish because everything else has been said in English. Lo primero que tienen que escuchar es que tienen 10 casos pendientes al momento y tenemos 136 casos que son negativos y en adición tenemos 143 personas que estamos vigilando. El número de observación no ha subido, pero se espera que suba un poquito más, ya que estamos en el fin de semana y no estamos haciendo monitoreo en estos momentos. La señora que está haciendo el sign language, el lenguaje con las manos, no lo hace en español y por eso fue que se movió. En adición, usted también escuchó el personal de 911 que estaba diciendo que van a mantener a sus empleados, están haciendo un plan de continuidad para sus negocios y de ahora en adelante cuando alguien llame al 911 van a preguntarle si tiene algún síntoma de coronavirus. Ellos están trabajando para asegurarse que si tienen que enviar a alguien, que envíen a alguna persona que tenga mascarillas y que tenga la protección que les hace falta. Dosti habló un poco sobre activar un grupo de voluntarios que nos va a ayudar muchísimo. Le damos muchísimas gracias a Luis Estrada que está ayudándonos a compartir información pertinente y real. Por favor, manténgase informado, no con los rumores. Por favor, dejen de propagar rumores. Si ve algo que le preocupa, por favor, vaya a la página de COVID en Facebook, vaya a la página de Shawnee County, vaya a la página de la ciudad de Topeka, vaya a KSNT, a WWW y a Capital Journal, porque ellos tienen la información correcta. Luis Estrada está pasando esa información también en Gente Latina para que usted tenga la información adecuada. Le estamos pidiendo a los negocios que es muy importante que si usted es un negocio crítico para la comunidad, que empiece a hacer sus pasos de continuidad de negocio. Es muy importante que se comunique con nosotros y nos deje saber si su negocio es un negocio crítico. Y crítico quiere decir comida, quiere decir artículos médicos, quiere decir cualquier cosa que sea necesaria para mantener a la ciudad moviéndose. Finalmente, aquí no creo que tengamos más nada. Además de la información, le queremos reiterar que estamos trabajando para ustedes. Esto es un maratón, esto no es una carrera de 100 yardas, de 100 metros. Eso no se va a acabar rápido, pero seguiremos dando la información honesta, información a tiempo, información que va a ser crítica para que usted se proteja a sí mismo y a sus familias. Muchísimas gracias.
And at this time, we will open it up for any questions that our Facebook viewers are asking, or if any of our media partners here have any questions. Just please address who you'd like the question to go to.
So I have a Facebook question here for Linda. So Topeka is not in a position to have a 30-day shutdown or anything right now, correct?
We are not ordering a shutdown right now.
And if there are no further questions, I would just like to thank Jolene so much for being here to interpret for some of our viewers. Is there an additional question?
There's one.
Okay.
For me.
I don't know who.
It would be.
Okay.
Excuse me, Linda.
Okay, what type of protection for hospitals providing these? Sorry. What type of protection are the hospitals providing for seniors who need to be seen at the ER because the doctor says it has some sort of virus?
I know the ERs and the hospitals have some protections in place. I don't know the details that would have to be directed to them.
Thank you all. We will resume our daily press conference tomorrow at 5 o'clock. Thank you.